a very good morning to you and welcome back to Daybreak. And it is Wednesday, so when Wednesday comes, we want to talk about matters health and nutrition. And as we do that, of course, something that is giving us a lot of tumbo joto ni siasa, but today we're talking about other things. And I'm going to allow my guests to introduce themselves. Of course, ladies first, so go ahead.
All right. Hello, everyone. My name is Dr. Elizabeth Warwe, and it's a pleasure to be here. Thanks for having me.
All right. Karibu sana and Happy New Year and welcome back.
Happy New Year. Thank you.
All right.
Muko salama. Majina ni Felix Okot. So my name is Felix Okot. You're always nutritionist.
Yes.
Thank you.
Kabisa. All right, so today we'll talk about gastritis and hyperacidity. So I guess first we'll describe that so that any people, if you find yourself in the definition and you have some questions around gastritis and hyperacidity, you can feel free to ask. So let's start with the definition of the two.
Let's start with gastritis. Gastritis is the inflammation of the lining of the stomach. And that's a term that is reserved for someone who's actually gone to the hospital and has been tested, because it's a histological diagnosis. So you find most people have the symptoms of dyspepsia, what we commonly call dyspepsia. That is epigastric pain, vomiting, nausea. So all that is dyspepsia. But for you to actually say you have gastritis, you've gone to the hospital and some tests have been done or some imaging has been done and it's been identified that you have gastritis. So hyperacidity now is the excessive production of acid in the body. We normally have an acid called hydrochloric acid in the body. So when you have hyperacidity, it means that acid is being overproduced or it's excessive in the body, more than is normal. Yes.
So if, how does it look like? Because you said there's imaging. How would it kind of course, without scaring the people, how would somebody who has that look like? Umechomeka, because tukisikia acid, tunajua tu ni kuchomeka.
So when you go to the hospital, there's an imaging test called endoscopy or OGD. So when you do an OGD, that's a test where you have a pipe that has a camera in it. Let me just use the word pipe. So it's taken through your mouth all the way down your gastrointestinal system. So as you visualize, if you have gastritis, you'll have inflammation. Inflammation is now reddening of the mucosal lining. If it's severe, you could be having bleeding. Yeah, so mostly you see reddening of the mucosal lining of the stomach or of the gastrointestinal system. Yes.
All right, and so what would be some of, before we talk about the causes, how would I know that I have any of these? Okay, because, of course, before going for the test.
Before I go there, there are two types of gastritis.
Okay.
There is acute or sudden, and then there is the chronic one. So the acute or sudden, it comes with a very sharp symptoms. Very sharp symptoms, pain, abdominal pain, too much acid, but it doesn't last for long. It can disappear after some time. Now the chronic one, it's gradual. The symptoms are gradual, and it's the most dangerous one, because if you don't really take a chance to go to the hospital, and that's why I advise people, when you start having abdominal pains, you start having abdominal issue, gas and everything, go to the hospital to be checked up, because you don't know what is causing that. Because it's chronic gastritis, if not treated, then it leads to ulceration, like Dr. said, the wounds in the intestinal lining, that inflammation causes wound. And this wound is what we call an ulcer. So it depends where the ulcer will be. It's either on the stomach or in the small intestine as duodenal ulcers. So if this is not also treated, then the bacteria can seep into the wound, causing something called peritonitis, infection on that area. So among the two areas, like the cardiac say, the tests that can be done before I come to your question of symptoms, we have something called barium X-ray, okay? They give you it's like a coloring agent that you take in your stomach, and then it colors, like it gives a color of your stomach lining. So when they do an X-ray, they're able to visualize that. There is also one called Urea Test. So in the Urea Test, they give you a urea component, so that you swallow, and then you'll have to blow your hair before you swallow the tablet, and then also blow your hair after. So the color will show that most likely when you take the urea tablet, the bacteria feeds on it. So that gas produced will show that. Then there is also the blood test that can be done, but not very accurate. I think Dr. can say that. The blood checkup to check on the cause of the bacteria, and then there is stool checkup that is also checked to see what is causing this. So the symptoms are several, and one of the things, when you have inflammation of the stomach lining, meaning that when you have inflammation even on your hand, there will be pain. So abdominal pain can be there. And apart from that, due to inflammation, poor digestive system, there can be overproduction of the hydrochloric acid, like Dr. said. Now, overproduction of this hydrochloric acid sometimes can flow upwards to the chest. That leads to hyperacidity, or it can lead to the ulceration of upper area. Unasikia mtu anasema niko na ulcers, which you diagnose yourself. It does not mean diagnose. And Dr. has said the only way to diagnose that is inserting that pipe that has a picture that takes the intestinal lining how it is. So the symptoms is either abdominal discomfort like gas, or abdominal discomfort, loss of appetite, you lose appetite. Apart from that, there is also, we have the acidity. Some people also have general, even fatigue can be there for some people. When it's so chronic, then there is also can be, when your stomach is irritated, remember, you pass out your stool. So some people can even diarrhea, or some people can even vomit. But when it's so worse, because the stomach lining is irritated and there is blood oozing out, your stool will have some component of blood. But there are several things that can also have component of blood in the stool. Maybe you have something called like hemorrhoids, which is the enlarging of the vein on your anal area, and several more, and some other symptoms that the doctor will also say.
Right. So you talked about, okay, so first talk about the other symptoms first before, because ulcers is such, kila mtu anasamanga, utanipatia ulcers.
Yeah, so basically it's most of what Felix has mentioned, the bloating, a lot of gas, vomiting or feeling nauseated. The main symptom that people have is epigastric pain, which is described as sharp in nature or burning, and it's usually hunger-like, so it comes before you eat or when you're hungry, and it's episodic, so it comes from time to time. So when it's severe, that's when you've had the gastritis for a long period and it has not been treated. So you get now the severe symptoms of hematemesis, that's vomiting blood, and there's hemoptysis, that's coughing blood. So when you find yourself you're having vomiting of blood or coughing of blood, then now you're getting to the severe spectrum of this gastritis. There's also something we call hematochezia, that's when you pass frank blood in the stool, or something known as melena stool, that is black stool. So also when you find yourself passing black stool, you know you're having a bleed in the upper GI system. So when blood is digested, it becomes black. So when it's black, just know the bleed is somewhere up in the gastrointestinal system. And worse still, it can still come with anemia. So there are people who may have silent gastritis and present to you with very low HB. So one of the tests to do for such people is to check for gastritis. People who come with low HBs, anemia, and you've checked everything else and you're not finding the true cause, definitely check for gastritis, because it can be a silent cause of anemia. Yes.
And so how is it related? Because you mentioned people self-diagnosing, and if they feel something, they say it's ulcers, they go buy over-the-counter medicine. I won't mention the name, but yeah, wanazikunywa, you know, hizi nakaka maziwa. So how do you differentiate between ulcers and maybe sometimes gas, and is there a relation basically?
There's definitely a very huge relation, and with ulcers there are so many causes. So we start with drugs. There are drugs like aspirin, which people use, or the people use it for pain. There are those who are prescribed by a doctor for cardiovascular diseases. There are things like alcohol that can cause gastritis, smoking, physiological and psychological stress. By physiological stress, I mean things like burns, if you have burns, or trauma, maybe an accident, all those can cause gastritis. And there's a very important culprit of gastritis, a very common bacteria known as H pylori. So that is the very most common cause of gastritis. And let me tell you about the numbers of H pylori. So in the world, 44.4 billion people have H pylori today. That's about 63% of the world population. And in Africa, 7 out of 10 people have H pylori. And that's just an average. There are some countries that have very high prevalences. Here in our country, Kenya, we have more than 70% of people with H pylori. That's about 37 million. And you find that this H pylori, besides causing peptic ulcer disease, or what we call stomach ulcers, it is a very major cause of gastric cancer. Yeah, so it's responsible for 60 to 70% of stomach cancers. So it's very important to if you have such symptoms, go to a hospital, get tested, so that if it's found, it is treated. Yeah, because gastric cancer in Kenya today is on the rise. It's it's ranked 6th as a cause of death in Kenya today. Wow. Yeah, so the numbers are quite high. But as much as the prevalence is so high, you find that not everyone with H pylori will have symptoms. Yeah, so if you have symptoms, it's very much advised to go and get checked. Yeah.
So maybe to add on top, like you asked, is there a correlation? And like Dr. said, gastritis is inflammation of the stomach lining. Now, what causes the inflammation of the stomach lining? One of them, Dr. said, the bacteria, okay? Now, the bacteria H pylori is a bacteria that is gotten from contaminated food. But the other bacteria, there is typhoid, there is amoeba, and all the rest, that can still irritate the stomach lining. And apart from that, there are medication, and Dr. will tell you we have non-steroid anti-inflammatory drugs, such as we have the diclofenac, aspirin. Is aspirin a part of them? Aspirin and all the rest. So when you take them long term because of treating of something, they might also cause irritation in your stomach lining. Even the medication we use for arthritis, or even radiation so many cancer patients goes through, or even hypertensive medication can cause irritation on the stomach lining. Apart from that, we have alcohol because it irritates your stomach lining. Then we have now the lifestyle, the food, spicy food and all the rest, which we'll talk about. People who stay hungry, like now, people who fast for long. Because if fast for long, there is nothing in your stomach, yet your stomach produces hydrochloric acid to digest food. This long term can irritate your stomach lining. And apart from that, even stress, when you're stressed for a longer time, it can also affect different production of gastric juices. Now, once your stomach lining is irritated, meaning there will be too much now production of what? Hydrochloric acid. Now, this will lead to acidity now. Now, people say, I have acidity. Now, long time hydrochloric acid, too much of it, or acid in it. And apart from that, is not only hydrochloric acid, there is also the bile juice. So the bile juice comes from an organ called the bile duct, okay? Now, the bile helps in digestion of fat. So if you are often taking fatty food, there will be too much production of bile juice that can still irritate your stomach lining. So once there is irritation of stomach lining, too much acid production, which will cause ulcer, which we say is a wound in the stomach, then what will happen? Poor digestion can also occur. And when there is poor digestion, there is now discomfort. Now, what will happen? When there is too much acid, it washes also the stomach lining. So when the stomach lining is washed away, the good bacteria is also washed away. Remember, the stomach has good and bad bacteria. So what will happen in that scenario? The bad bacteria will act on food. And then with bad bacteria acting on food, now the stomach will start producing gas. So you start feeling gassy and discomfort, okay? Now, apart from that, now long-time hyperacidity can now lead to the acid refluxing back, because now it will weaken it's called the sphincter. So sphincter is a closing on the stomach lining that when food passes in, it opens, and when food goes in, it closes. So when there is too much of acid flowing back to the chest, then it weakens the sphincter. And now this is what causes the gastroenteritis reflux disease, whereby the stomach lining, enteritis means irritation.
So that means J.
Yes. So the enteritis is inflammation still.
Yes.
So the stomach lining is irritated. Then what is happened? There is a reflux again of the acid back upwards. So because the sphincter is weakened. So long time of that is where now you vomit, a lot of discomfort. So in that, what happens is you can be given medication to suppress that acid production so that you don't reflux, or they can do for you something called fundoplication, whereby the upper part of the stomach is a bit wrapped to the esophagus to tighten the opening a bit, okay? So all these symptoms are almost related. When you have acidity, when you have gastritis, the symptoms are almost related. But the severity now depends with the level of acidity or a level of ulceration. Yes.
So you need to basically go and get checked.
Yes.
I want to ask if you have any questions surrounding the same, you can go ahead and use the SMS platform, which is 22422, or the hashtag Daybreak. Either one of those will get your questions answered today. If you have any question around acidity, gastritis, hyperacidity, ulcers, hizo zote hapa kuna reservoir of knowledge. So you can go ahead and ask them. So 22422 and also hashtag Daybreak. Are there specific, you mentioned that if you eat a lot of fatty foods, then it can cause this. Are there any other foods?
There are foods, and I think as I talk of food, Doc will also talk on medication and management and treatment. Yes. Now, on food, remember we have said food needs to be digested, okay? And what helps in digestion of food is the hydrochloric acid that is being produced. So if you take food that leads to too much hydrochloric production, then it can lead to irritation a long time. And these are mostly to people who eat food faster. You eat so fast. Binging. Yeah, so that you don't tend to chew food well. Large balls of food goes to your stomach, and because digestion starts in the mouth. So if you don't chew food well and this large bolus of food goes to your stomach, then it will lead to too much hydrochloric being produced to break them down. Okay? Then apart from that, we also have people who love coffee. Now, coffee, coffee is good to making you stay awake, but it's one of the irritants of the stomach lining. Now, the connection with hyperacidity or inflammation, we say it's an irritant, okay? But with hyperacidity and reflux is because it also tends to, research shows, it tends to weaken the sphincter that we talked about. So too much coffee.
So what is too much coffee? Like
too much coffee, what I want to say, if you take a cup of coffee, every single day for a year, that is too much coffee.
Really?
Coffee is not food. Oops. Coffee is not food, okay? It's like you want to tell me tea leaves is food. Tea leaves is not food.
So if you start off your day, you know, they say start your day with coffee so that once in the kama ukorada.
If you are okay, then there's no problem. But the moment you realize you have abdominal issues, you have ulceration, you have discomfort, then tend to regulate your coffee. Or even after taking coffee, don't take it on an empty stomach because the irritation will be more. You can take it after meal.
Sorry to cut you short. That's interesting because, again, on the flip side, there are people who say so, like, for example, if you're intermittent fasting, uchukue coffee kwa sababu inasaidia metabolism, sijui nini.
Can they prove how it helps? Or it's just a mess?
It's just hearsay, I guess.
Yeah, so I will say don't go to meat unless it's proven by science, okay? So things like coffee, things like too much tea leaves. So if you have to take tea and you have irritation on the gall lining or you are susceptible to that, then do not take ile chai imeingia sana or tea with a lot of black tea. That conch black tea, concentrated one. So don't take that. And then apart from that, there is the alcohol part, which is also a precursor. And then there is a fatty food. And in fatty food, we say like things like chips and all those deep fried things, sausages and all the rest.
So too much of this.
Yes. What happens is when you take too much of them every single day, there will be that overproduction of bile juice to digest it, which will lead to too much acid within your system. And there is also the too much taking of sugar. If you have realized you have gas or you have discomfort, then don't take too much sugar because sugar leads to a good environment for bacterial growth. So not too much sugar and sugary foods. Apart from that, we also have the spicy food, commercial spices that we have in the market. There are irritants also in them. And then apart from that, some people also, there is a bit of milk issue, but milk is a bit, I would say it's confusing to some people because when you have the symptoms, when you take milk, cold milk, it's sweetened and then calcium tend to block much of the acidic production. But the danger of too much fresh milk is that milk has fat in it, okay? So digestion of that fat requires bile juice, and then the proteins and the calcium in milk is not easy to break down. And that's why it can cause diarrhea and constipation. So anyone suffering from gastritis or issues of the abdominal, either take lactose fat-free milk, or apart from that, take a non-dairy product milk. And there is this notion of rice milk, okay? In soup with rice, and so many more. We talk on how to help the diet now.
Rice milk, rice soup. Wachana, mimi unajua natoka Kano, where we grow rice. Wacha rice ikue tu rice. Anyway, you're free to explore. So when you realize that you've got the treatment, does your diet change? Is there what kind of medication do you take?
So once you have those symptoms, so it's always advised to go to the hospital and seek medical advice. So any of those symptoms we've mentioned earlier, the vomiting, the epigastric pain, the bloating, so go to a hospital and get checked. And as we mentioned, there are a number of tests that we do. We have the non-invasive and invasive tests. The non-invasive is what he had mentioned, a serological test, which is not normally done anymore, the blood test. It's a rapid antibody test. It's not very sensitive, so it has become obsolete. Then there's the fecal antigen, which is the one that most hospitals use, and there's the urea breath test, which is very specific, very sensitive, but very expensive. So you find that most facilities do not do it. So the fecal antigen test is the one that is commonly done and commonly used. So you do that test, and if you're found to have H pylori, then now there's a regimen that is used to treat that.
There's a kit.
There's a kit for that. Yes, and then there's the invasive test, now the one I had mentioned earlier, the endoscopy or the OGD. So once you do that and you find you have the inflammation, there's treatment for that. And if you're found to have H pylori, if it's found to be positive, there's treatment for that. So if you're treating reflux, if basically all you have is reflux, there's no H pylori, or all you have is hyperacidity, the treatment is usually an 8-week course of PPIs. PPIs are proton pump inhibitors, what we know in the market as esomeprazole. I know people are quite familiar with that name. So if it's purely reflux, that's what you use for 8 weeks. So continuous use of those medications. And they're very good ones in the market, like Esomac from Cipla. There are a number of those medications. So you use them for 8 weeks, then you go back to your doctor, and then you get checked if you're having any further symptoms. If there's recurrence of symptoms within 3 months, then you're termed to be having chronic reflux or chronic GERD, gastroesophageal reflux disease. So within those 3 months, if there's a recurrence of symptoms, then you're put on maintenance medication. So you'll be on those PPIs for quite a longer time. If within the 3 months there's no recurrence of symptoms, then now you can be on intermittent therapy. Every time you get the symptoms is when you use. So on this other hand,
so if you're given the, because having experienced GRD myself, so ukipewa zile dawas, eat 30 minutes before, take 30 minutes before you eat, and it doesn't work, then the problem is deeper.
The problem is deeper. Okay. So you go back to your doctor, get checked for further tests or for further diagnosis.
And what about if the reflux has come to the point where it affects like meno ya nyuma and stuff like that?
Yeah, so there are other extra esophageal symptoms that you can get, things like cough. The people will have a chronic cough. You treat that cough thinking it's a pneumonia, you think it's a upper respiratory tract infection. There are people who come with sore throats. Yeah, so at that point, it's very good to now refer this patient to a gastroenterologist, so who will do further tests and treat all that. Yes, because acidity, if it comes back, remember this is acid and the pH is quite low, so it can corrode even your teeth if you keep having recurrent and chronic reflux. So it's very important if you get to that stage, seek further help. Yeah, so I was mentioning now treatment if you found to now have H pylori, which is now the bacteria that is quite prevalent, you have to now go under the kit. You have to use the kit. And this kit is used for 2 weeks. It has antibiotics, 2 main antibiotics, very strong ones. And it can be quite heavy. Have you used it yourself?
Yes.
Really? Yeah, so you know how.
Inakuja kwa box.
Box mbili kubwa.
Yes.
Yeah, so it's very, very intensive. So it's very good to have a full and frank conversation with your patient. Tell them that this is a kit that is quite heavy. It has 2 very strong antibiotics that have to be taken for 2 weeks continuously. And it's also good to tell them about the challenges of it, because you will have things like diarrhea.
This is true.
You will have vomiting. You will have, there are so many things, side effects of this medication, because remember the antibiotics. And you're taking them every day, morning and evening, for 2 weeks continuously. So it's good to tell the patients about this. And then on the other hand, also tell them that if you do not take this medication, the effects that will result after that, what we mentioned, the peptic ulcers disease, the gastritis, the gastric cancers. So the medication, as I mentioned, is 2 weeks. And then after that, you take another 2 weeks or up to even a month of a PPI, the proton pump inhibitor, like esomeprazole. So for the whole treatment, it's 4 months. It's 4 weeks, sorry, a whole month. So after a whole month of medication, you're advised to go back to your doctor again to recheck if you still have the H pylori and to confirm eradication. And it's as much as it's very prevalent, the success of treatment is very high, up to 90%. That is if you've been given the right regimen, because there are very many. And there's first line, second line, third line. So you always start with first line, especially for someone who's not been on any H pylori treatment. So you start with first line. If you've given the right regimen, and the patient has adhered to the medication and there's no history of any antimicrobial resistance, it's also good to take a history of any antibiotics that the patient has used previously. Because sometimes, you know,
this is for any other...
Any other, yeah. Because you see, people get a home and then they go to the pharmacy and they take an... they're those ones we buy. Yeah, so you're actually increasing your chances of getting resistance.
Yes.
Yeah, so once you adhere to that kit and take it for 4 weeks, you go back, you get checked for eradication. And as I mentioned, its success rate is very high.
And do you take, so if you have, let's say, what is like the period of time in terms of to inform the doctor that I've been using antibiotics? Like, is it 2 weeks, a month? When does it matter before you start the treatment?
I think up to even 6 months. Because antimicrobial resistance is quite prevalent and it's quite bad if you have that resistance because you're using 2 antibiotics, so you could be resistant to either. So it's always good to tell your doctor that I've used this. So if you've used any of the antibiotics that you're going to be given, the doctor will actually now decide to go to another regimen and give another one. So it's always important to inform your doctor.
All right, so we're gonna be taking your questions in a short while, so keep on sending them on 22422 and hashtag Daybreak. So Felix, once you realize, okay, I'm told there's a lot of feedback, so I guess we'll start with that. Okay, let's take some of your questions then before we proceed. A viewer wants to know, can hyperacidity lead to cancer?
Yes, as I mentioned, hyperacidity, and mostly from this bacteria known as H pylori. So if you have H pylori, it definitely has to be treated, especially if you have those symptoms. Make sure it's treated and it's completely eradicated as you go back to check for eradication.
But the good news is the success rate in treating it is
the success rate in treating is high.
All right. Okay, next question. When I eat ndoma, kwisha mimi, a lot of acid and chest pain. Please talk on that. Ben wants to know.
So Ben, there's so many food that can lead to hyperacidity or discomfort to your stomach lining. And as I would say is that people tend to have different feeling with different foods. I wouldn't say the foods are very specific because there are people who eat the ndoma and they have hyperacidity and they're okay. And that's why I say, if you have hyperacidity or ulceration, or let's say hyperacidity, and having the ulcer now people call hyperacidity ulcers, okay? So if you have hyperacidity, listen to your stomach, and anything that you feel that irritates it, tend to avoid it. That is the first thing. Now, ndoma is not a precursor to so many people, but very few. So if you feel ndoma is affecting you, then avoid ndoma. Apart from that, some people also suffer from the wheat products. So some people are good with brown bread, but some people are also bad with the white bread. So if you feel any of them is affecting you, and because wheat is not easy to digest, tend to avoid the wheat product. Apart from that, some people also suffer with the sweet potato. Some people are good with it. So if you're good with it, well and good. If you're not good with it, avoid. But the other thing that is for so many people and is common is the acidic foods. So orange, passion, pineapple, and lemons. So these are precursors of acidity because they are adding to the pH of the stomach that is already acidic. So which one can you take? We have the watermelon, we have the mango, but even mango for some people it causes. We have the banana for some people it causes. Then we have the apple. But now if you have worse hyperacidity, peel the outer coat of the apple because it requires hydrochloric acid to break it down. So if you take it, it can affect you. So you can peel the apple. But the problem is, for some people also it causes gas. So listen to your stomach. Then we have the sodas, the carbonated drinks. Also, they tend to interfere with your stomach lining. Apart from that, we talked of milk, we talk of fatty food, we talk of commercial spices, and all I will say, it's good to take probiotics. Like Dr. has told you, we have the proton pump inhibitors that tend to block the acid production, and some people are also given the antacids. But proton pump inhibitor, and there is one called H2 blockers, which is histamine blockers, which also tend to block the production of acidity. Most of these drugs, a proton pump and histamine, take them 30 minutes to 1 hour to meals. Then any antacid should be taken at least maybe 30 minutes or 1 hour after meals, because and then the help doesn't last. So and that's why you avoid these acidic foods. So
what about ile, sorry to cut short, kuna wakati unasikianga ni kama unachomeka, si una Because there are times that you really feel like you are actually...
Yeah, so there are those times you'll feel that burning sensation. So sometimes we give the tablet, that is the PPI or the H2 blocker, with a syrup. There are so many syrups in the market. So you can give an antacid. So that one is actually very good because it causes immediate relief as it goes down your esophagus. Yeah. So when you have that instant one, it's always good to take it with a syrup.
All right.
So as we continue, there is one thing that is very important. If you're watching on your gut or you start having gut issues, we always tell and advise patients, or if you are on any H Pylori kit or any antibiotic for any bacteria, because these kits also and the antibiotic, they also interfere with the gut lining. And that's why people get treated with H Pylori or hyperacidity, but the symptoms will remain with you for years. So this person will keep on going to the hospital. And that's the reason is the gut lining is already destroyed. So you need to bring your gut lining back to health for proper digestion. And that's why actually nowadays we work hand in hand with the doctors. When you give H Pylori kit or antacids or any hyperacidity drugs, also give with probiotic, which are good bacteria for the stomach lining. So naturally probiotic come from vegetables and then yogurt, things like that.
No, because somebody's asking.
Yes.
Is yogurt good for people?
Good, very good, because it's pre-digested, so easy to digest, unlike fresh milk. So yogurt is also good for lactose intolerance, because lactose intolerance, when your stomach is not able to digest the energy in milk called lactose, so you become intolerant to it, and this can also cause what? Irritation of the stomach lining. So we give you a probiotic which are prescribed from the pharmacy, but they have no effect to your stomach lining. You can take them even for 10 years daily, and they will not affect you. They have no side effect because they are food to the stomach lining, good bacteria. Now, the good probiotic, there are so many of them in the market, but any probiotic with lactobacillus, that is the good for hyperacidity. These others are not very good. They are those that colonize your gut, bring your gut digestion. So we can give you one for lactobacillus, which helps to reduce the acidity, then one to colonize your gut so that to bring the digestion back to normal. But apart from that, we also advise people to avoid things like red meat, because red meat takes longer time to be digested. And it shows that those who take red meat for a long time, for when you are over 60 years, they have high chances of weakening stomach lining. And this can lead to something called itohernia, is whereby the part of the stomach bulges up to the chest, and that will constrict the esophagus, meaning food will flow back. And this is also one of the cause of gastritis. So we prevent you from too much intake of red meat, but there's actually, according to my deep research nowadays, actually I don't only tell people on food, we can also prescribe for you some supplement or tell you to eat some certain food, and one of them is food rich in vitamin A. Okay? Now, vitamin A is normally given children every 6 months, but doesn't mean adults can't take vitamin every six months, because there is a difference between eating and absorption. So yes, you can get it from rich food, but your body is not able to absorb it well. So vitamin A you can take when you have hyperacidity every 6 months, because what does it does to your stomach lining? It helps in something called epithelial cells. These are cells that line your stomach lining and leads to the mucus lining that is irritated due to irritation. So we can give you that, and apart from that, encourage you to take vitamin A rich foods such as pawpaw, we have watermelon, and so on, carrots, and so on. Apart from that, we have food rich in vitamin E, which comes from most green leafy vegetable. But remember, sukuma wiki and even spinach will lead you to hyperacidity, so avoid. Then, so green leafy vegetable have vitamin E, which is anti-inflammatory. But if you have worse and severe chronic gastritis or hyperacidity, we can give you vitamin E supplementation. And study shows any supplementation of vitamin E below 400 IU cannot cause toxicity to your system. So we can give you this for 4 months. And then the other thing we can give you is also omega-3 fatty acids, or you can take cod liver oil, because it will prevent too much fat from your stomach and also breakdown of fats. Then something with the B complex, B1, B2, B3, even B6, because they help in enzymic production for digestion. So we can tell you food rich in that, or supplement that you can take in a range that will not lead to toxicity in your system. The other thing is water. Water balances your pH. Take a lot of water, plus so on, that I'll answer as patient, our viewers ask questions.
Somebody here asks, at times I feel pain under my diaphragm. Whenever I'm hungry, and sometimes I'm unable to stand upright. What is the cause? What would be the cause?
Okay, so let me start by differentiating pain that you feel when you're hungry and pain that you feel when you're full. So pain when you feel when you're hungry or before you eat, that is mainly caused by gastritis or peptic ulcers disease and all that. So it's mainly pain from gastritis. Pain you feel after you feed is mainly from reflux, so the gastroesophageal reflux. So this one that she feels before she eats or when she's hungry, that's mostly the peptic ulcer disease or gastritis. But it's good that she goes to a hospital and gets checked for what it is. So what she can do is, for now, to just calm the pain or reduce the pain, is use the proton pump inhibitor, the esomeprazole, or the syrups, as I mentioned. But it's very important that she goes to a hospital, he or she, and gets checked to verify or to identify what really is causing that pain.
Yeah, because when she can't stand.
Yeah,
that's intense. Sarah from right here in Nairobi, she has done endoscopy and colonoscopy in 2019, found chronic gastritis treated but didn't go away. I have to survive with OMES like daily and farting too much. What could be wrong?
Yeah, so as I mentioned, there are those people who have gone through the series of tests and imaging, and still they find themselves still having symptoms, what we, as she mentioned, chronic gastritis. So it's always important that at that point, if you've been seeing a general practitioner, make a point of seeing a gastroenterologist, that is a consultant. Yes, from there he'll be able to pick it up, because probably she's even having a wrong diagnosis. Because if you've treated for a specific period of time, the required period of time, and the symptoms are still present, it's always good either you seek a further diagnosis, find adherence, whatever she was given. Is she adhering to it? Is she adhering to the lifestyle? Because again, you have to adhere to the kind of food you have to eat. And then yes, now seek further help, maybe a gastroenterologist. She could be having further or more worse symptoms or further diagnosis, yes.
All right. Viewer says he or she, didn't leave the name, had acute gastritis last week. I'm told the liver enzymes are high. What is the relationship with liver enzymes and...
You see, like I will put in a layman language, okay? The digestive enzymes are produced by, we have said the hydrochloric acid and then the bile. The bile is closer to the liver, and the liver enzyme also help in breakdown of some food, such as fatty and carbohydrates and everything, okay? So when you have poor digestion, and mostly when the liver enzymes are checked, they might rise, okay? And remember, the digestive tract also tend to help in removal of ammonia, which is also associated with the liver, right? So if the ammonia levels are high, it will also affect your liver enzyme because of poor digestion and bringing them out. So this can lead to liver issues, and that's why anything that will affect your liver, when you're having issues with gastritis, avoid, and which is we talk of fatty food, and then because it will lead to bile production, which will still affect your liver enzyme, and then apart from that, the sugary food, which are also associated with the liver issues, and anything that lead to too much production of ammonia. But to add on top, maybe Doc can also add on top on something in that question.
So just to add on what he's saying, foods, when you eat foods, and even chocolate is actually among them, and I know we are heading to...
because Valentine's Day, so he mentioned coffee as well.
Yes, coffee.
So, kuna drinking chocolate?
Drinking chocolate as well.
Yes.
Yes, coffee, drinking chocolate, fat, as he mentioned, alcohol. So what they do in the body is that we have the esophageal sphincter. So the esophageal sphincter is tonically contracted. So when you're swallowing, it relaxes, and then after you swallow, it goes back to its normal rest position. So these foods that he's mentioning, once you eat them frequently, or if you have acidity, what they do is that they weaken that sphincter, especially if you're chronically prone to having the reflux. So once they weaken the sphincter of the esophagus, it means the effortless return of food and fluids will be very much more frequent. So that's why you're being advised to avoid such meals. Yeah, so I think that is what I wanted to add. Oh, with the liver, sorry. So when you have elevated liver enzymes, it means that you're having some form of hepatitis. So one major cause we mentioned is alcohol. Alcohol can cause gastritis, and when you have elevated liver enzymes, it means there's a toxin that you're taking in to cause those enzymes exactly to go high. It could be an infection, but now since we're talking about gastritis, the most culprit or the most common cause is alcohol. So if you're taking in alcohol and your liver enzymes are high, then you know this alcohol is the one that is causing gastritis. So at least try and check, what are you taking alcohol, because that is mainly the one that is related to gastritis. Yes.
So kama uko kwa dogio, utajua iko shida. Right, gastritis and hyperacidity, is it related to fungal infection or yeast cells?
Not really. There's no relation,
okay.
yes.
what happens if you did all those tests for H pylori and it came negative, but you still have the symptoms?
That is now what I had mentioned earlier. That is now you have gastroesophageal reflux. Yeah. So what you're having is reflux, or mainly or purely just hyperacidity, because you can have overproduction of acid in the body without the H pylori infection. So that's what now I mentioned. You have to be on a long-term management of the PPIs. It's unfortunate you're taking drugs every day, but it's the only way that can help you. So if you have H pylori negative, your H pylori negative, it means what you're having now mostly is reflux or just purely hyperacidity. So the main thing, the mainstay of management is lifestyle management. And with reflux, some of the mainstay lifestyle management things that you can do is, if you're obese, it's very good, or it's very important to work out to reduce the central obesity, because increase in abdominal pressure will aggravate the acidity. And then things like eating food, the food you eat small meals frequently rather than eating sahani kubwa tu mara moja, one touch. And then also after eating, take 3 hours before you lie down. 3 hours before you lie down to allow the food to be digested. Also when you're sleeping, it's advised to raise your head, at least your head to be raised to prevent the reflux. And then when you're wearing clothes, avoid tight-fitting clothes, because that again will also aggravate the chances of reflux. Yeah, so those are some of the main lifestyle management things that you need to do if you're having recurrent reflux, because now you see there's nothing to treat really, you manage the symptoms. Yes.
All right. Which age bracket, I think I meant to say, is more vulnerable to gastritis and hyperacidity? How many
It can affect anyone, but I want to mention or to emphasize, if there's anyone above 60 or above 50 and is having those dyspepsia symptoms, if you're having the epigastric pain, if you're having the abdominal pain, make a point of going to the hospital and be done for the imaging test, because you find that above 50, above 60, most of these symptoms are just more than H pylori. You have the gastric cancers. And it's very important to note that eradication of H pylori will bring recession of gastric cancer by 60 to 70%. So if you have or you've been diagnosed with gastric cancer and the cause is H pylori, and it's diagnosed within the early stages, if you eradicate the causative factor, which is H pylori, 60 to 70% remission occurs. So that age bracket of 50 and above, 60 and above, make sure you go and get checked. Yes.
Or checked. All right. Every time I take any food made from wheat, I get heartburn. So Felix, you talked about this.
Yes,
So you can, I almost said roll back the tape, but you can check on YouTube later on. How can a pregnant woman who is infected by gastritis cope with pregnancy? Can gastritis get healed completely? Because again, the medication, I think, is...
Yeah, so in pregnancy, unfortunately, now when you're pregnant, there's increased abdominal pressure, as I mentioned. So pregnant women tend to suffer a lot from a lot of hyperacidity, a lot of reflux and heartburn. Yes. So it's unfortunate that that's something they have to deal with. So we normally advise mothers just to take the medication for that period, or when you're having the symptoms. And luckily enough that after the pregnancy, the symptoms subside. But if they continue or if they persist, then now you continue with the PPIs, yes, with the antacids.
Maybe I will also add on that. And as we have said, the doctor has said there is pressure. The baby is bringing pressure to the abdomen. And then you want to eat too much food that is also causing pressure to your stomach. Then that will lead to acid coming up or the nausea symptoms. So when you have gastritis, mostly what we advise, before you're given even medication, change of lifestyle and diet will be very important. You remember, pregnant mother doesn't drink, they don't take coffee, they don't take tea leaves, okay? Maybe we tell them to take milk or chocolate because they are less inflammatory, okay? But I advise people not to take the normal cocoa because the normal cocoa is not easy to digest. So it can easily bind with salt, it can easily bind with calcium and fat and form stones, either in the gallbladder or in the kidney. But the milk or chocolate are more refined, easier to digest. Now, change of lifestyle, avoiding 1 or 2 foods that cause this will help you. And the best way, people react differently. See a nutritionist will advise you on that when you have that issues, and also when you have issues with the hyperacidity or nausea, also your gynae will help you on that. Yes. All
right, so for the next set of questions, I'm going to just read all of them back to back. We might not answer all of them, but they're going to give you the way you can reach them after this. So someone asks, how do you counter hyperacidity without taking medication? Another one asks, does adding pepper to your meals trigger hyperacidity?
Actually,
does it?
Actually, that is it's much of a wide area for some people. And my patient always ask me, mwindi anakulaga pepper from January to
ako tu sawa.
So I will say the stomach lining adapt to what you cause it to. It's like those who people take ile pombe haramu ile nyumbani. It is so much acidic, but it doesn't. So it depends on how your stomach adapt. But I would advise, if you have gastritis or issues with acidity, avoid things like pepper.
Okay.
Because they will lead to more irritation. It will not lead to more acid production, but irritation will be there. Some people also talk of ginger easing acidity. Yes, and the reason why ginger will ease acidity is because of the anti-inflammatory effects, natural anti-inflammatory effects of ginger. But too much of it exceeding, let's say, this is a thumb size,
yes,
will be too much for you and crush it. Some people also talk of garlic because of the anti-inflammatory, but too much of it can also cause that. So really check on what you are eating, and that's why you'll come, we'll advise you. You know, now we are teaching you, but when you come, we'll see you as a client and advise you.
And what about tomatoes?
Even tomatoes are very good. So if you have acidity or heartburn, peel your tomatoes before you cook, and then little tomatoes in your food, or even raw onions are not good for you. So raw tomato, raw onion, not good
salads,
for you. Cook them. Yes, cook them. Or even the dengus and the beans. So the yellow beans or white beans are better, but because of gas, soak them overnight. And carrot, when you take carrot and dip inside and boil, it tends to remove that acidity. Or you boil and then you wash them out, and then you put in the freezer. That freezing tend to condense the air and press the air out. And so many other things that we can do to help that.
All right, so what we're going to do is we're going to allow you to tell the viewers where you can be found, so that at least there are so many other questions we haven't tackled. Apart from serikali na kazini na vitu zingine na relationship, kupatia watu stress wakati wa Valentine. There are so many people going through so many things. So how can you get found?
You can find me at Mata Karen, the well. We're also on Instagram. My hashtag is called what?
Your handle?
My handle. It's Liz_Shiko. Yes.
All right.
Yes. So you can find me at Mata, and I go to almost all their clinics, so I'm not a specific place. So you can call me over their website or Willis number yangu.
Yeah, man.
But allow me to say this.
Yes.
There are so many children with heart conditions in the country. And so many of them have died because we have Mata Heart Run that we always assist children with heart condition. I know it's not what we came to discuss, but helping a needy child is very important. So we are almost closer to the month of Mata Heart Run to help those children suffering the heart condition, and we do them surgery free of charge because the public donate to that. So I will advise the public to take this course and support Mata Heart Run. We can check on our website the dates. They will have a meeting in KICC. You buy a t-shirt to support a child's heart, or you can come where they will have a venue in Nairobi, and let's help these children do surgeries, because so many of them are in the line. The last Mata Heart Run happened in 2018. So we are going to have one this year, and we ask you kindly tend to see how you can help support a child with that condition, so that we help them. Yes, thank you.
All right, no problem. Always important to help children. I want to end it there, but of course, like we said, in case you want to get in touch with them, you can follow them on the platforms, go to Mata or reach out to me. I'll hook you all up. Hope you've learned something. Apologies that we didn't get to some of your questions, but again, you can reach out to them. We'll see you again here tomorrow, where now that you have all the information, we'll avoid tomatoes, ginger. No, ginger ni mzuri. Alcohol is good. Anyway, hatutaki kudanganya watu. But anyway, everything in moderation. Everything in moderation. So have yourself a wonderful day. Successful people look like you. Peace and love.